KSJE this morning with my guest, as I mentioned, from San Juan Regional Medical Center. Joining me once again, Meghan Ritz is back with me in Studio A. She is a physician assistant and also the assistant medical director for the Metabolic and Bariatric Institute at San Juan Regional Medical Center. Welcome back to KSJE.
Hi, good morning. Thanks for having me back.
You bet. Good to have you here. Our topic today, as I mentioned a little bit, is on Harvest Health, which certainly piqued my interest and curiosity about what that is. And so talk to me a little bit about what Harvest Health means to folks.
Sure. Harvest Health is a fruit and vegetable prescription program.
Okay.
It's a way to help people access nutrition.
Got it. Which we all should be doing anyway, right?
Yes.
I mean, that's the idea. But so this is a little bit more formal, I suppose, and a little bit more organized maybe, or supervised?
It is. So a lot of times patients will go see their primary care provider or other medical providers, and they often get the message, you need to eat more fruits and vegetables. You need more fiber in your diet.
Right.
And they leave it at that.
Ah.
And for many patients, it is hard for them to understand, well, what does that mean? How do I eat more fruits and vegetables? So we talk about access. Not only can I afford fruit and vegetables, but even if I can, what do I do with these? How do I eat them? How do I enjoy them?
Right. And so it sounds like there's a little bit maybe about the preparation and other ways to maybe enjoy these foods that maybe we weren't aware of before or haven't tried before?
Yeah, so there's some of that. And then it's also just the support, the education, not only about nutrition and how it impacts health, but again, how to prepare these fruits and vegetables and incorporate them into our diet.
Got you. And this is all part of the Metabolic and Bariatric Institute work that you do at the hospital?
Well, it is. So it's actually a collaboration. Fruit and vegetable prescription programs have been around for decades.
Right.
The idea of these types of programs is not only to improve patient health, so if they suffer from diet-related diseases, just monitor those outcomes when you help somebody access fruit and vegetables, but also it's a program to help strengthen the local agricultural economy and then to create partnerships within the community that have like-minded intentions and goals with health, wellness, or even just agriculture, growing crops, supporting farmers who's doing that work.
I see. Okay. And so what I think I hear you saying is that if I buy local fruits and vegetables, that is healthier for me than buying maybe store-bought fruits and vegetables in certain ways?
In certain ways. I mean, it's certainly healthier for you because you're getting, produce that's coming right off of a farm that's local to you. But it's also just about that agricultural health and the economic health of the community that we live in.
Sure. I understand. I'm supporting a local farmer when I buy from them.
Correct.
Yeah.
Correct. So it's a win-win. It's a way to support your community. It's a way to also support patients' health and well-being. It's a way to create access to these types of foods and fruits and vegetables.
Right. But if a tomato's been sitting on a truck for a week to get delivered to me in Farmington, New Mexico, that can't be as healthy as it is coming right from the farm yesterday.
Correct.
Got it.
Yes.
Okay. And so this is all very important. Are there some fruits and vegetables that are better for us than others? Or are they all about the same?
I would say they're all about the same. They each have their unique properties, and
Okay.
they each have their different profiles and different types of, minerals, fiber content, but the more the merrier.
Okay.
And if you don't like one vegetable, skip over that one and try something different.
Right. There's certainly something out there that maybe you would like.
Correct.
I would think. So
Yes.
that's true. Now, there's something that I was told to ask you about, and that is when it comes to kale, which I think some people love it and some people have yet to love it, or maybe are having a hard time loving it.
Right.
But I was asked to ask you about massaging kale.
Yes.
What is that all about?
Right. So massaging kale is actually very important.
Okay.
Lots of people have...
I am riveted to your answer.
Yes, lots of people have said to me, I don't like kale when I make it at home, but when I went to the restaurant, it was really good. I tried it there. The key to kale, a kale salad, is massaging it because it's a really fibrous plant. And so when you add acid to it, like lemon or some kind of vinegar, and just really rub it and massage it and kind of beat it up a little bit, it releases that fiber content, it gets rid of some of that bitterness, and then you can add salad dressing and different add-ons to the salad, and it really changes it. So
Interesting.
it's great. It's good for your health. It's also good for your emotional well-being. You can work out aggravation.
Aggravation. Yeah, I'm just thinking about that later tonight. I've got some kale is going to be in trouble. But,
right.
But yeah. So, and that's interesting because I don't necessarily see that in some of the recipes that include kale, which seems to be a lot these days, to tell you to do that. And so that's something that's I've not heard before.
Right, and so that's the beauty of this class as well, is patients or participants, when they sign up, they come to the education part of it, and that's how they receive their prescription, which is a bag of produce from our local farmers. And so we show them what's in the bag, we have recipes ready, we demonstrate a recipe and let them taste the food as well. And then we just open up the floor to conversation and allow people to share or talk about different ways they might use produce, share tips on how they can massage their kale to make it taste good. So it really is just a win-win where patients are not only learning how to use these foods, but they're also learning from each other and supporting one another.
Got it. And so this is more of a class that folks could sign up for?
That's a big part of a fruit vegetable prescription program, is the education part, the class, the
Gotcha.
learning and the hands-on
Very
and
good.
the practical tips.
Okay. And so this is going to be offered on Tuesdays during this month of September?
So it's offered Tuesdays during the month of September.
This month, right.
This is our pilot study.
Okay.
So it is a collaboration between the college, the Metabolic and Bariatric Institute, also with the New Mexico State University Extension Office, San Juan County partnerships as well.
Got you.
And so we have about 15 participants, and we're just looking at outcomes, doing some surveys to understand what are you doing now with fruits and vegetables, how many servings do you eat a week, that kind of stuff.
Okay.
And then we'll do another survey at the conclusion of the program, and then follow some of these participants through our clinic and just continue just looking at behavior change.
Gotcha.
With the goal of then demonstrating, hey, this works, so that we can apply for grants and additional funding and be able to extend this to other offices and clinics and specialties within not only our hospital, but also other primary practices within our community here in
Right.
Farmington.
Right. And so it's a pilot program right now, and so then if folks are listening to us going, wow, that sounds really interesting, I want to sign up for that, they can't do it just yet, but
Not
they
yet.
should watch for maybe the next class, I guess, right?
Yes,
That would
it's-
maybe be 4 sessions? Give or take?
About 4 to 8 sessions,
I see.
and we'll have to wait until our next growing season.
Sure, that makes sense.
So we're going to be able to look at the outcomes and really think about what we did well and what we need to improve upon and how we can increase our capacity for next growing season, and even start earlier so it can be a longer series of classes.
Right, understood. I'm looking at some of the classes that you did offer this month, talking about Cooking 101, so just kind of maybe a basic lesson about cooking and
Yep, basic
cooking
skills,
techniques.
how to use a knife, how to store my food, food safety, some of those just basic things.
Very good. Making recipes work for you.
Learning how to substitute things, so if you don't like kale and you don't like massage kale, you can maybe try spinach.
Uh-huh.
So just not being afraid or timid by recipes that might not have the ingredients that you have on hand, or the ingredients that you don't like, how to make it work.
Right, okay, very good. And another class about mealtime madness.
Oh yes, everyone's favorite. How do I make meals work for me? How do I do it when I'm busy? How do I meal prep? What does that mean?
Right,
Just some of those techniques and tips.
okay. And then shopping on a budget.
Yes, everyone's favorite as well.
Right,
How to use what you have in your pantry, add in fruits and vegetables to augment the nutrition content of some of those basic staples, and then how to navigate that grocery store and buy things that will fit your budget.
got it. And so these classes have been offered for free to your participants, right? And so, again, do you expect maybe that to continue if you can find some grants and things like that? Is it your idea to offer this for free to the community?
Absolutely. And with that prescription, again, being the bag of produce.
Right.
So go home. Now we've told you, eat more fruits and vegetables, and now you know how to do it.
And you have a bag in your hand.
And you have a bag in your hand.
There you go. Very good. Well, talk to me more, too, about the work that you do with the Metabolic and Bariatric Institute as well, because that is year-round and
Yes.
full-time.
Yes.
And so you are helping folks every day, I think, when it comes to being healthier in their lives through this institute at the hospital, right?
Correct. Yeah. So we do both medical weight loss and surgical weight loss. But the heart and soul of the program really is that lifestyle change. Tools like medicine and surgery are really important for patients to help them with losing weight and then achieving better health through weight loss. But also, that lifestyle, that is what is going to carry them through and really help support those efforts that they are making. So looking at nutrition, looking at physical activity, stress management, sleep hygiene, all those basic things that sometimes we just need additional support with.
Right, true. And everyone is different when it comes to weight and weight loss, I would think, too, correct?
Oh, absolutely. It's very unique, and it's just, as you said, it's different for everybody.
Right. And I know I don't know this, but it seems to me that as we age, we tend to maybe put on more weight, or it's harder to take it off, or harder to maintain a weight that maybe we want to maintain. And maybe that's because we're not doing as much physical activity as we were before. Maybe our metabolism is slowing down, or maybe it's something else. I guess it could be many different things.
It could be that, but a lot of it also is, your body adapts and adjusts, and at some point it decides that, hey, I kind of like this body weight. It's like a thermostat. So it protects that higher body weight, even though it's not healthy for you. And so when you decide, hey, I'm going to lose some weight here, I want to get healthier, you lose 10 pounds, you work pretty hard at it, right? A lot of patients come to me and they say, I work so hard, but it comes right back. And that's because your body is defending that higher set point. And so really helping somebody engage in those lifestyle changes and make it so that those exercise habits are non-negotiable, and eating fruits and vegetables, really focusing on protein, just some of those things that are going to help lower that set point. It's hard, but that's where we really can focus our efforts with patients so that they can achieve health and hopefully maintain that weight.
Sure, that makes sense. And I think it's important that folks realize that. Do you find that some patients come to you and say, I've tried every diet on earth and I think I just need surgery. I just need some other more different treatment, I guess.
Absolutely. And some patients come and they say, I know I need surgery. I know I want surgery. This is the best choice for me. And some patients come and say, I want to try lifestyle. I want to try and do this on my own. And maybe I want to try some medications. And it is oftentimes those patients come back 6-12 months later and realize that really surgery is going to give their body that fighting chance. Because with surgery, it almost resets your metabolism, and it makes that lower set point for body weight come more easily. And so surgery can be really helpful to just get somebody started, get the weight off, and then also keep that weight off. And it's much easier with surgery to do that. And so, it's not a wrong choice. It's not the easy way out, and actually is a really great tool for a lot of people.
Right. It's an option, I guess.
It is.
For individuals, and that's all part of coming to talk to someone like you about what the options might be for individuals, correct?
Correct. But whether you decide to use medications for weight loss, do it yourself, use surgery, it's all, we're working off the same platform, which is improving the lifestyle.
Right.
Eating better, exercising, sleeping, managing stress.
And being healthier. Right. I would think when folks lose weight and they're not carrying around an extra 10, 15, 20 pounds, that adds to another, or helps a lot in other ways as well. Maybe their joints feel better, maybe their knees feel better, their hips feel better, things along that line. There's other benefits too, correct?
There are. Actually, those, about that 3 months after surgical weight loss, or when I've been working with a patient for a good amount of time in the clinic, I love it when they come back and they can start telling me, I'm sleeping better. I have so much more energy, I can keep up with my kids, or my knees don't hurt so much and I can actually walk further. I love those victories.
Right. Now, we were talking before we came on the air this morning about the last time that you were here to visit with me, and it was just, I think, shortly after the Metabolic and Bariatric Institute opened at San Juan Regional Medical Center. So that's about maybe 2-3 years ago?
No, it's only been about a year and a half.
A year and a half.
A year and a half.
Oh, I forgot that already.
I know, it feels like 2 or 3 years.
Maybe it does to me, but how's it been going? Give us an update on how things have been going in the last year and a half, pardon me.
Things have been going really well. Our program is slowly growing, which is nice. We have hired another practitioner, so we have Ryan Bozell, who's a nurse practitioner, and he's doing strictly our medical weight loss program because we have a lot of patients that want to start there or just want medical weight loss. So we've really grown, and it's nice to add on some other providers to help with our services. We're looking at just other ways, for example, like Harvest Health, other community outreach programs or opportunities where we can just really work with our community.
Sure.
Not only our individual participants and patients, but also just ways to help with families and everyone really who is interested in accessing better health.
Makes sense.
Yeah.
Makes sense. It certainly seems that you have job security, especially in this country. We seem to have a weight issue in America, and a lot of access to food that may not be as healthy for us as one might want and like. And so Is that frustrating or just it is what it is?
It is what it is. It is frustrating. The work I do, I feel like it's just a drop in the bucket, and sometimes I feel inadequate and like I'm not doing enough, but at the same time, again, when I impact one patient who's then taking home lessons learned and tips and helping their family become healthier and having their kids learn how to do it differently and do it better, right? As patients often say to me, I want my kids to do this better. I don't want them to suffer like I do. I mean, that to me also just speaks volumes. That's a great place to start. So, yes,
True.
we certainly have a lot of job security in this country, but I have hope.
Right.
I have hope.
Well, and again, when you talk to those patients and see those success stories, I imagine, again, it's got to be very gratifying after the work that you do and with the work that you do to see these lifestyle changes or surgical outcomes with folks that are now healthier and being able to do more, as you mentioned. So
Right.
that's got to be great. And a lot of this, too, I think, correct me if I'm wrong, sometimes it's habit, right? And so if children kind of see their parents picking up healthier habits, that might trickle down to the next generations.
Absolutely. Studies show that kids who see their parents engaging in healthier habits are more likely to do the same. So watching mom and dad exercise, growing a garden, eating fruits and vegetables, being open to trying new things, it definitely will help your kids engage in that behavior.
Gotcha. Yeah. Very good. And again, learning how to maybe use those fruits and vegetables in meals and recipes and serving them, again, is really important.
Right.
Do you have any advice for folks maybe when they're in the drive-through line of how to make better choices for their intake?
Yes, I mean,
avoid it.
Avoid it. The first message is please just don't. But life is busy. That is a big habit that's very hard for a lot of people to change. So when I work with patients, the advice just is choose better. Maybe a grilled chicken sandwich instead of a fried chicken sandwich. Skip the French fries. Ask for the apple slices. Look for salad opportunities. Skip the dressing. Just stop, think, choose better. And then think about the quantity. How much do I really need to eat? Am I eating because I'm hungry, or am I eating because this tastes good?
Right. True. Very important. I had a friend of mine that was talking the other day about maybe making a decision to only maybe get French fries on the weekends.
Yeah.
And so 5 days healthier.
Right.
2 days not so much.
Right.
But small steps.
Small steps.
And is that something?
Absolutely. Small steps are important. Every little step adds up. 1% will eventually become 100%, right? And also being realistic and understanding that, hey, I like French fries. That's okay.
Right.
But maybe not every day, and maybe not an extra large, or maybe just, those kind of deals with yourself. Only if I go at a sit-down restaurant will I get French fries and I'll share it. But everything in moderation, be realistic, set yourself up for success, and those 1% add up.
Those are steps in the right direction.
Absolutely.
Got it. Very good to know. My guest this morning, Meghan Ritz, is here. She is with the the Metabolic and Bariatric Institute at San Juan Regional Medical Center. It has been open for about a year and a half now, talking about all their success in both lifestyle changes, medical and also surgical options for weight loss for folks throughout the region. And I guess I would think that your patients come in from throughout the region, right? I mean, you have a pretty large reach and folks coming to you for help?
Yes.
Very good. And different options for them as well.
Different options.
As you talk with them, so that's great. Very good. If folks want more information, do they need a referral to come and talk to you folks?
Yes, we do ask for a referral from either a primary care provider or a medical specialist. But yes, we do need referrals. And we do ask that patients have a primary care provider, because those people are also super helpful and really important in patients sticking to their goals and achieving weight loss and doing that for the long run.
Right. Very good. But that's important. But once they get that, they can come talk to you. And as you mentioned, you just expanded your staff, so you have more folks to help.
Yes, absolutely.
Very good. Well, thank you for coming in this morning.
Thanks for having me.
Always great to visit with you and get some great, useful advice.
Yes.
Appreciate it very much.
You're welcome.
Massaging Kale.
Massaging Kale.
That is going to be the headline.
It's a game changer.
That's the headline for today's show. Thank you very much.
You're welcome.
Good to see you. My guest this morning here on KSJE.